welcome to my channel Nursing Medicine. This is me Sharanya Sajid. So today I'm going to discuss about 14 stations of aptitude exam. So I'm not going to explain in detail about each station, just I'm going to explain briefly in each station what you can expect and possible stations you can expect for your aptitude practical exam in Ireland. So let's see, don't skip this video. You have to see until the last of this station. So you will get an idea like which all are the station you will get in the examination and what you have to expect or what you should do in each station so that you can easily prepare for your exam. It's very brief explanation so that you can watch the full video. So we will start. I have just written everything here so that I won't miss any station. So first, I'm going to explain. You may get a station with patient has chest pain. So they will give the scenario like so and so patient, this is what, so something like that. They will give the situation and they want you to do some questions, like want you to do some task. So as I mentioned in my previous videos, of always you have to read what is your task. So most of the time in chest pain cases, what they want you to do is you have to do the assessment, chest pain assessment. Pain assessment is very important. So you know how to do the pain assessment. You have to ask the patient about the severity and where is the pain and intensity. All those things we are doing in the pain assessment, isn't it? So that's what they want you to do in that station. If you are getting a chest pain station, first of all, they will ask you to do the assessment. And then they may ask you to do the nursing care plan. Nursing care. In that nursing care, what you have to do means maybe you can give medication. So for that, what you should do, you have to check the cardex if any medication is prescribed for this patient for the chest pain. So that is maybe like if that patient is prescribed for the GTN, you can administer the GTN. So in this station, you are not going to administer just you are orally telling like I'm going to give the GTN to you like that, because the examiner will be acting as a patient. So there is no real life scenario in the practical examination. So you have to pretend like you are giving that, and maybe you can reposition the patient to make sure like the patient is comfortable. These are things you can do in this station. That's the first station I just explained. Then second, I'm going to explain a station where they are going to assess your technical skill. So you may get a patient who has chest infection, not the chest pain, chest infection like breathing difficulty and all. So they may ask you to administer the nebulization to that patient. So there, what they are going to assess is how you are administering nebulization. So you have to identify the patient, talk to the patient, communicate with the patient, before administering the nebulization, check the cardex, is that prescribed for that patient. Then wash your hands and take the trolley near to the patient and administer the nebulization. All those steps you know. So they are going to assess those technical skill. You may get a station to assess your technical skill, how you are administering the nebulization. Then next station is a patient who has constipation. You may get a scenario of the patient who has a constipation. So they will give a they will give an idea to you that the patient has so and so discomfort. That means the patient has a constipation. So there, they want you to confirm the patient has constipation and give some health education. So how can we confirm the patient has constipation? What we are doing, we have to do the assessment. So you should know how to do the assessment for the constipation. Yeah. So for that, you can ask to the patient like, did you pass bowel? When is the last time you passed bowel? You can palpate the abdomen of the patient. If it's distended, yeah, we can guess it's constipated. And we can ask, what's the last meal she had? What are the food she is eating? Did you drink water? These are the things we can ask during assessing the patient who has constipation. So that's the way you are assessing. So once after assessing, you realize that the patient has constipation. The patient is telling like she didn't drink anything for last 12 hours or something like that. Or patient is telling I didn't pass bowel since Monday. Something answer. Of course, they will give the answer. So from that, you are diagnosing or you are coming to the conclusion that the patient has constipation. So once you come to the conclusion, what you have to do is you have to give the health education to the patient. So how can we give the health education? So you should tell, yeah, after talking to you, I confirm that you have constipation because your abdomen is distended, you haven't passed bowel for 2 days, or you didn't drink well, those things, and you are hospitalized and you are not mobilizing well. These all things can elevate the chances of this constipation. So like that, we can explain to the patient and make them to mobilize, like give health education, like mobilize for a few times every day and drink lots of water. Include food has lots of fiber like vegetables and fruits, and you can explain, like if it's more severe, you can ask the doctor to prescribe any lactulose or any kind of stool softness. So that's what you have to do in that station. So that's another station. The next one is a station where patient has COPD. So in that station, they may tell the patient has COPD and breathing difficulties, once the symptoms, do the vital signs. So in that vital signs, I have mentioned, like here we have like a separate sheet for the vital signs. It's known as new early warning sign, and there you have to check the vital signs of the patient and record in that. That's what you have to do in that station. Next station is a patient who has a diabetic mellitus. So in that station, they may give a scenario of the patient who has some symptoms. Maybe the symptoms of hyperglycemia or the symptoms of hypoglycemia. If it is hypoglycemia or hyperglycemia, that you have to identify by assessing. How you are assessing? Ask to the patient. Then after assessing, you realize the patient has hypoglycemia, means you have to do some nursing care for that. If the patient has hypoglycemia, what we can do? Give some sugar drink, any juice or milk with sugar or anything you can give. And you can check the cardex for insulin, and if it is insulin is not given, you can give, or if it's already given, you can ask to the patient, did you eat anything after eating insulin? So if the patient is telling, patient didn't eat anything after like she took insulin, means you have to tell to someone, like we have to order breakfast or something for this patient, bread or cup of tea. That's enough. So that's the station who has a diabetic mellitus. Those are the 5 stations I explained. Then the 6th station is patient who has head injury. So in that station, just a minute, my baby is crying. 1 second. Yeah. Next, you may get a station where the patient has head injury. So if you are getting the station with the head injury, there what you have to do means you have to do the neurological assessment. What is neurological assessment? It's nothing but it is a Glasgow Coma Scale, GCS. I have already done a video regarding GCS in my channel, so you can go back to the videos and you can see what is GCS, or otherwise you can check in the RCC site. They have explained about GCS, Glasgow Coma Scale. That is a neurological assessment. So if you are getting a patient who has a head injury, what you have to do? You have to do the neurological assessment. That's the next station. Then another station is you may get the patient who has say any surgery. For example, the patient has abdominal surgery and you have realized that the patient condition is deteriorating. Maybe the patient is getting infection or something like that, and you have to explain that to patient. Okay, that means that's not a good news. You have to explain, already the patient had the surgery, patient is admitted in the hospital, and after surgery she got infection. So that's a bad news for the patient. So you have to explain that to the patient. So how can we explain? First, we have to maintain that rapport with the patient by communicating. And after that, what you should do? You have to follow the ISBAR. You know about ISBAR? I think so. If you don't know, I will give another video about ISBAR. ISBAR is nothing but first identify the patient. That means first ask, is that you or something like that. Like you have to ask the name. That is identification. Or check the ID badge. Then situation. What is the situation? Here the patient has infection. That you are going to explain. Then is bar, background. What's the background? Background is a surgery. You just had the surgery. And A is assessment. So you have to explain, like when we did the assessment, there is a yellow discharge from the surgical site. That means it is infected. Then R. R means identify. R is a recommendation, sorry. So you have to give what we can do for that. Maybe change the dressing daily, or you have to start the antibiotic, or whatever is the recommendation, you have to explain. That is a station you can get. Then another station is eighth station. You may get a station where you want to call the doctor because your patient is having some symptoms, or they have some emergency there, and you have to call the doctor. So in that same thing is bar, you have to follow. You should talk to the doctor through the phone. Have to call the doctor. And we are calling from this department. My patient has these symptoms. All those symptoms they will give. Okay, the scenario. That scenario you have to tell. So just make sure the doctor is coming and seeing the patient. So for example, if the doctor is telling that he cannot come, he is busy or something like that, you have to make sure doctor should tell, I will come. So you should tell like, oh, no, doctor, because she's very serious. Maybe I can do something until you are coming. Like that you can tell, and finally doctor has to tell, yeah, I will come. Then only you have to disconnect the phone. If you are not making sure the doctor is coming, that means you will fail in that station. Okay, don't forget, you have to make sure the doctor should say, I will come and see. Meanwhile you can do something. That's okay, that can be accepted. But the doctor is telling, I am busy, and with the rounds, they may tell like that. So in that time, if you are disconnecting, that means you are not succeeding that station. Okay, that's another station. Then a ninth station, you may get a station with seizure. So in that seizure station, what you have to do is you have to know the nursing management of seizure. What's the nursing management? In seizure, we cannot do anything. First, we have to just assess the patient and make sure the patient safety. That means environmental safety. If the patient is in the nearby any chair or something, we can remove all the obstacles from the environment, and we have to assess the duration of the episode and what is the symptoms, what are the symptoms she is showing when she has the seizure episode. These all things you have to do. So in that station, you have to, like, when you are doing this station, you know, like, I am assessing, but examiner doesn't know what you are doing. So you have to talk verbally. I'm assessing the patient because in this time we don't want to do anything. Just we have to observe the patient and make sure the patient is safe. Like that, you have to explain verbally and make sure the examiner is understanding what you're doing there. Okay. Then next station is station for the patient who is waiting for the surgery. So in that station, patient is so worried, or the patient has a fear about surgery, or the patient is nil peroral. So you have to give the psychological support. So, you know, like, have to give, maintain a rapport and just give some kind words to them and give some psychological support. Then another station is a patient who is in end of life. That means they will be nearly at the end of their life, and that patient is DNAR. DNAR is nothing but it is a status where we are not resuscitating that patient if the patient is showing any unresponsiveness or no breathing, because there is no chance of getting the life. So in that time, the doctor will decide this patient is for DNAR. In that case, we don't want to do the DNAR. In such kind of patient is deteriorating, and that time you have to call their next of kin or the relative to explain the patient condition is deteriorating. You can come to the hospital to visit them if you want to see. So if you are telling that, like, when you are communicating those things, just remember about ISBAR. Apart from that, you should be more sympathetic. You should understand the situation of the relative, because we are going to tell like their mom or dad is deteriorating. That means we can't tell like your mom is not willing, please come if you want to see. Don't speak like that. You should understand the feeling. I'm very sorry. I just want to tell you that your mom's condition is very bad now. It would be better if you're if you come and sit for a while with her. So like that you can explain. That time the patient's relative will be so panic, oh my god, what happened? Then you can tell like, don't worry, I'll be with her, sorry, I will be with her until you are coming. Like that you have to be more sympathetical when you're dealing those kind of situation, like when you're sharing a bad news. Okay, that situation also you may get in your exam. The next station may be a station which is assessing a patient who has no breathing or unresponsive. What you will do? Of course, CPR. So you should know about how to give CPR and emergency management. Then next station may be you will get a patient station to assess the technical skill of your medication management. So maybe they will give a card exam to assess any medication error, or sometimes they will ask you to give medication. So that time you should remember about 10 rights of medication. That's very important. Then next is the station you may get for technical skill, which assesses the abdominal wound dressing. So that is one of the very important station. That's very easy station because we know how to do dressing, and even they will give a class for how to give dressing. But the problem is that we should do the time management. If we are not doing the time management, we may fail. Most of them will fail in this station because they don't have the time management. So make sure every station you will get 10 minutes. So make sure you are doing everything fast, at the same time perfect. You should remember about the universal precaution, everything. Okay. Then so that's all about all the stations, and I think I have some more sample station that I will do in my next video. So I hope this video will be helpful for all of you. So if it's helpful, just give the comment and like. So that's all for today. I'll see you with another video. Bye bye. See you.